Good morning. Exciting day in the Philadelphia area. Both of us getting ready to see the Eagles in the NFC Championship. Both of us have tickets, so we'll make this as brief as we can so we can get to the festivities. But today we're going to extend on what we talked about last time. We're continuing to talk about the movement continuum, which is our system for assessing movement to either see as physical therapists what patients need to be treated or what they're ready for around pain, and then as strength and conditioning professionals to show us what needs to be trained. Last time we talked about the static positions within any movement. Today we're going to touch on the transitions, which is the dynamic change from one position to the next. So we'll lead off with you, Corey. Why don't you go into thinking about how you use transitions, how transitions are kind of segued from the positional work that you're doing when you're working with patients or with clients that are in a strength and conditioning realm.
Yeah. So I think of transitions sort of from a client's perspective are probably easier to understand and relate to the thing they're coming in for initially, just because it is dynamic. And say I'm having trouble getting up and down from a chair due to pain, it may be as part of that transition where you're experiencing that. So once you get into the transition point, I think there's just an easier carryover connecting the dots with the client or patient in front of you. But the general way I look at it is you have this eccentric phase, which would be the lowering phase. So if you're thinking of getting up from a chair, it would actually be the sitting back down part. And then you have the concentric phase, which would be the getting up part from the chair. And I've found it helpful actually to kind of break those two down into just two separate assessments almost, where I'm seeing how well can someone control the descent to a chair, followed by how well can they actually stand up. And typically, I think we've seen, and the research shows that people are stronger eccentrically, meaning that they are better able to control the lowering phase than they are the getting up. And I think that varies actually a little bit movement to movement, but overall, I like to start with more of the eccentric phase of a movement, see how people do lowering or getting into it, kind of getting into that position that we discussed last time. And from there, I like to see the concentric point and the coming out of it phase. But from a strength and conditioning perspective too, can kind of think of it in more of an athletic setting as this idea of load to explode. You need to be able to accept load, whether it's you're making a cut or, you're going to throw a pitch or something like that. You need to be able to kind of coil your body up to a certain extent, accept load so that you can then redirect it throughout your body and either change directions quickly or in the case of a pitch, release the ball at a high velocity.
Yeah, I think you brought up a couple interesting points there. I mean, first off, the idea of positions versus transitions in a rehab versus fitness realm can be very different, like in the idea of what the client or patient is coming in for. So it's almost more acceptable to do more isometric stuff in a rehab center to feel like, we're trying to keep things safe. We're not going to move as much. We're going to try to teach you how to engage your muscles. It can be more difficult to get some buy-in from a strength and conditioning side of things when you're just doing positional work that's static, but it's pretty important. And it's often still the first thing we want to look at just to demonstrate control. But when you get into transitions, it becomes something that seems a little bit more like fitness when we're starting to move a little bit. But in the physical therapy side of things, especially if people's symptoms are very active or they're sensitive to movement or they're fearful of movement, we have to have a very slow to fast way of looking at these transitions. And then when you bring up the idea of eccentric versus concentric, I'm generally in the same boat where I like to look at slow eccentrics first, and just from a perspective of if you're going to teach anyone a movement and they're just not strong enough to do that movement, usually they're not strong enough to do the concentric, but you can get them to do some version of the eccentric before they can do a concentric. So you just think of the typical, can't do a pull-up, but you could start with the negative of a pull-up. You can't do an actual push-up, but you can usually slowly lower to the ground. But I think that it depends on the velocity. So the inverse may be true is when we start getting faster with movement, we actually might want to do the concentric before we do a fast eccentric, just because of the difficulty in decelerating. And that's a lot of times in athletic movements when people do get some type of muscle injury, it's during deceleration, or which is eccentric in nature, but it's fast eccentric. So slow to fast is, makes the most sense a lot of times when you're working around symptoms, because it's just a natural segue from what we're doing with the static positioning, right? Like static position, we're trying to have it be as well understood as possible before it gets too complex. So that as we start to go into transitions where we're going from one position to the next, it makes sense to go as slow as possible. And actually on the down versus the up, we can figure out if something's hurting, if there's a loss of posture, if there's an impact control issue, which we were talking about our markers of control last time, that you can really see pretty well during the eccentric phase. Do you slam down hard at some point, or can you keep the impact control through the whole eccentric phase? And we get to see all those things pretty well. And then we can add some dynamic, speed into the mix.
Mm-hmm. Absolutely. What so you were talking about the idea of lowering slower, or really controlling that eccentric, especially in a rehab setting, but probably a fitness setting as well, and a performance setting where you're focused on, like you just said, sort of that postural control, being able to actually demonstrate the ability to really own every inch of the movement you're trying to do. How do you normally like to start off cueing the concentric or the coming up phase? Are you cueing that faster? Are you cueing that slow, especially when you're initially starting to get into it?
I'll still start with that slow for the most part. The only exception to that would be if I just have somebody who's really brand new to exercise, and we're doing something that might look like a squat, but we'll call it a sit to stand, where I just want to get them up better, right? If they are used to using the arms of a chair, and they have to use this external support all the time to get up, and that's just what they've gotten used to, I may give them a cue with some momentum to just explode up. And I expect that they will lose a quote unquote postural control in that way, but I just want to see a little bit more explosion up. Usually it's not when there's a ton of symptoms that we're working around, but it's just more of a general lack of strength and conditioning. But if I'm looking at postural control, or if I'm looking at a symptom, I will make the exercise easier from a range of motion standpoint, and then ask them to go slower. So again, the easiest example is the sit to stand or squat, where you just make the chair a little bit higher, you add some cushions to the chair, and then you give them a cue to say, all right, try to stay as vertical as possible when you stand up. You may give them some type of arm reaching cue, reach your arms up a little bit higher so that your chest stays up, your eyes stay a little bit more up. And let's do that as slowly as you can, so you can feel, and I could see where you lose your posture, or if there is some symptom that comes on, I want to know exactly where within that range of motion, where within the initiation of movement the symptom comes on. So slow is ideal, but there are times where you actually want to give people the option of using momentum, or teach them a strategy that can help them propel themselves up with a little bit more velocity, because they're so used to going slow that slow is almost inefficient at that point. And in the grand scheme of things, like slow movement is really inefficient, right? But it can be very valuable from a standpoint of building strength, because there's more tension that you're teaching people to put in through their muscles. But from a functional standpoint, like if you're moving slow, you're usually being inefficient. And so think of like strength training is, it's not the way that we would want to move things, but we're trying to be inefficient in our training so that we can be super efficient later, and life gets easier.
Yeah, I like that point a lot. And I think too, one of the key points that you hit on about the slow movement in general is using it really as an assessment. And because you are taking longer to perform the movement, whether it's a squat, push up, pull up, whatever it is, you're better able to, or the client is better able to detect and relay to you when they are feeling those symptoms. And I think that might be one of the most valuable points. And also, we talked a little bit before about, I think you touched on it, motor control, and sort of slowing things down initially may be a good way to help increase the control in a movement and sort of understand how it should feel as you move through it. But I really like thinking about, I think I start slow usually with people on the concentric, but then once I feel like they're able to kind of get the movement down to a certain extent, I like to start having them move a little bit faster. And interestingly, I found sometimes when I've had patients who have had sort of these chronic symptoms for a long time, I think I found success at both ends of the spectrum with them, where sometimes I stay slow for a while and that actually feels a little bit safer to them. But then sometimes when people are so in their head, and the word we'll use is hypervigilance, where they're kind of looking for these symptoms almost too much, that's where I've actually found sometimes it's helpful to focus more on speed and output. And then in a way, it kind of gets them out of their head. But I think that's just one tool, because there's research out there showing as well that using actually metronome training, and say you're doing an exercise like a lunge or something, and you have a metronome, you're doing 2 seconds on the way down, 2 seconds on the way up. That's another way to get people out of their head. And that seems to actually be beneficial for people experiencing more chronic symptoms, depending on the individual. But I think in the hypervigilance case, sometimes I find it helpful for them to switch their focus to output, when for so long they've come in thinking, they've been looking for their pain in every little movement they do.
100%. And I think it's good to have some type of checklist in your head when you're thinking about transitions that include speed, so tempo, the eccentric versus the concentric phase, as well as any type of idea of energy system, like what is the intent of your training. So for instance, if I'm moving slow on the eccentric, well, in some ways I'm purposely trying to work on strength in that matter, right? In some variation, right? But if I'm trying to explode up from just the bottom, just I'm sitting and I explode up, I'm working on power in that moment. And then we can kind of take the eccentric and the concentric and kind of blend them or flow them together. And that would almost be, I'm trying to conserve energy, so I'm going to do this in a more endurance-like fashion. So you have this continuum in your head, but you can make it like more of a checklist than it has to be exactly in this linear progression, because people are different. And there's so many reasons when you're a clinician that you're going to have maybe an order in your head, but you go outside of that order because something isn't working based on a symptom. And we're always dealing with the psychological aspect of pain. But also I'll give you a personal example of how, like, triphasic training, which, Cal Dietz's triphasic training, how without symptoms, but just the idea of the psychological limiter of like heavy weight and how strong you feel you can be, gets changed just by adding speed as opposed to going slower, right? And it makes sense when you think about it, right? Like you don't want to waste energy by going too slow on the way down. But if you got heavy weight on your back, you also don't want to crumble to the ground. So this act of practicing slow lowering, maybe getting more comfortable hanging out at the bottom, and then saying, okay, I'm going to take the brake off and I'm going to go down and up as fast as I can. I'm actually going to think about velocity on the way down and the way up. What I found is it totally got me out of my head, and I could actually explode through my sticking point a lot quicker. So whether it's an actual pain that you're working with, or you're just trying to get out of your head by saying, okay, this weight's going to crumble me to the ground, sometimes you have to go a little bit faster, so you give yourself some confidence that you can actually do more than you think. So I like that connection, but that really does go for rehab or strength and conditioning.
Yeah, totally. And one more point, I guess, kind of on the getting out of the your head point is I think especially too in the strength and conditioning side, if you're working with athletes, um, sport in general is so reactionary and anticipatory, and you don't have that time to think. And I find the weight room tends to be a lot more sort of cognitive.
Right.
There's a lot more thinking going on. So there's those points in a athlete's program where it's helpful, whether it's in sort of that triphasic training like you're talking about, or finding different jump variations or other just movements that the athlete is pretty competent in and doesn't actually have to think through, I think is a useful skill to train for them so that they're not relying too much on this cognitive sort of introspective mindset when then they get back to sport and it's just chaos and it's, they don't even have time to think, they just react.
Absolutely.
But you talked a little bit about energy systems and how does that relate to the things we're talking about today with transitions?
So with energy systems, we're thinking about three major ones, right? We have your creatine phosphagen system, your glycolytic system, and then your aerobic oxidative system. So a lot of the times you can think of that as a mixture of intensity and duration, right? So duration, I think, was one of the bigger ones. So the creatine phosphagen system allows you to go as hard as possible. So you can think of that as your sprint system, but you can only do that for a certain duration before you start using different energy substrates to keep the energy going. So really you could think within maybe 20 seconds, that's going to be your max ability to go at the highest intensities. And this could be with heavy loads, or it could just be with the highest speeds. So then after you go beyond that duration, and it's, there's a buffer there, so it's different for different people, but let's just say after about 20 seconds or so, you're still trying to go as hard as you can, but because of the duration, you no longer can go at that same output. So now you're starting to have to go into this glycolytic phase of training, and that's usually where you're going to get some growth in your muscles. It'll usually feel a lot worse too than when you're actually going as hard as possible in those 10 to 15 seconds. So anyone who's ever done like a assault bike sprint, the first 10 seconds aren't so bad. You start getting past 20 seconds and you're still trying to go as hard as you can. That sucks, right? And that's where you're usually starting to transition into a different energy system. And then as you start to go maybe past 45 seconds, closer to the 2 minute realm, again, different for different people, you're going to start to have to use oxygen for energy, and that's going to be your aerobic system. So the effort that you're intentionally putting in could still be high, but you're just not going to have as high an output when you start to go longer. And that's just because you're going to be using different systems. So you usually hear like aerobic versus anaerobic, right? So the first two systems tend to be more anaerobic. You get past a certain amount of time, you have to start using oxygen, then it's more aerobic. And that goes into how we think about transitions. So I like to think of generally like aerobic training at a certain point in time. I want my transitions to be a little bit more flow oriented, which is the way I like to look at it, where I'm actually trying to, in some ways, think about conserving energy. I want to be as efficient as possible when my intent is to go longer, is to go for greater endurance. And then if I'm thinking about this creatine phosphagen system, I want to be efficient if I'm going fast, but I have to create a lot more tension in the body. And right off the bat, my intention is not to conserve energy, is to go as hard as I can, knowing I'm going to be done in a short amount of time, right? So just the intention there of what we're trying to work on from a strength and conditioning standpoint is really important for how we train and even look at our transitions.
Yeah, I fully agree. And I think just that intent, understanding what you're trying to get out of a movement or an exercise or a set from that standpoint and conveying that to the client is just so important, because sometimes, if you don't tell someone they're supposed to be working at a high effort, then they're probably not going to, because naturally their body's going to want to conserve resources.
Absolutely.
So I think
And I would say vice versa, to cut in there, just because
yeah,
you get so many people that when they're coming in for fitness, they think they're just supposed to work hard. right? Like,
Mhm.
and without monitoring anything, you realize that there's a lot of people that don't realize they're working hard all the time, harder than they
Yeah.
should. So they really need to know the intent, especially when it comes to aerobic training, right? Like there's this mixture, this idea of aerobic training should be sweaty all the time, right? And you should feel like awful, and then you feel good afterwards. But like you really should feel like you're killing yourself in order to get some type of aerobic workout. And a lot of times it's the opposite, where
Yeah.
it should be okay. You can go longer. What does it feel like to be able to do this thing that we're doing? As long as you can, right? That's a very different feeling. So heart rate monitors are really helpful there just to show people it's like your heart rate's higher than it needs to be, or it's as high as it needs to be already. Enjoy that, right? Like you don't
Yeah.
have to go any harder than this. And it's always a success for me with clients when I get them to actually use a heart rate monitor because it's such a game changer where it opens their eyes to that they don't actually have to work as hard when we're actually trying to work on a more aerobic stimulus, and we can use that to manipulate their effort right in front of them, right? So it's not just this push as hard as you can all the time. And then, yeah, when we're trying to work on speed and power, a lot of people that are older or more in the general population of fitness non-athletes, they're not very powerful, right? And that's a very different feeling. Like that is all out effort, but it also doesn't feel like a lot of work in the grand scheme of training, right? Because there's a lot more rest breaks than there is actual effort, right? The effort might be just 5 medicine ball slams as hard as possible. We want to make those each rep as hard as possible, but I'm not going to make you do that many reps just until you get tired. It's about the spark of effort with each rep, and that's a difficult thing to explain to people sometimes. But just to have that understanding of energy systems and try to get that through to clients is really important because otherwise all you're doing is just doing some version of a speed endurance workout all the time, just
Yep.
because people want to get sweaty.
Yep.
So we really have to be able to educate clients on like, this is what this is supposed to feel like. It's not supposed to feel that hard, but every time you go out and do a rep, I want it to be as hard as possible, but then I'm going to give you a bunch of rest. And then when we're trying to work on endurance, it's somewhere in the middle. Like you have to actually learn how to conserve energy, how to breathe a little different.
Yeah, 100%. That comes back to the Charlie Francis sort of methodology of he was a sprint coach, but he was very big on effort should either be over 90 and 95% or under 75%.
Yep.
And that middle ground is really where things are often too hard to recover from, but
Mm-hmm.
not hard enough to actually increase power and or speed in his case. And that's just a small lens because I think there is a time to kind of work in that middle zone, which tends to maybe be the most brutal to go through.
Right, right, right.
But like I think a large portion of training that I think we both do with our clients and probably with ourselves as well is sort of fits the bill with that, where you have kind of your low, slow aerobic work, and then you have that higher intent work where you are going to get a lot of rest, but every rep or whatever you do is going to be with full intent to move it quickly.
Absolutely. And I think it's figuring out like what's the missing link for the individual.
Yep.
But connecting onto what you just said, it oftentimes that missing link is not the glycolytic hit. If somebody is actually active and they're doing exercise regularly and they're coming to you for something different, right? Something more, they're usually doing a lot of that mid-zone glycolytic training because that's what they think they're supposed to do, right? Like
Yeah.
hypertrophy training or getting to a boot camp and just pushing without any monitoring of what their effort is, really. Just other than are you sweating and do you feel like you worked hard? But then really hitting that beginning zone of how fast can you go? Can you create that spark? Can you create that power? What does power feel like? What does power mean? And then the other side of that is that can you monitor your heart rate and go longer without actually working as hard? Maybe working on nasal breathing or different breathing techniques where you're sort of teaching yourself how to be more efficient because that doesn't feel sexy, right? Like it.
Yeah.
I mean, I think sometimes you can make the sprint stuff and the glycolytic stuff, or sorry, the creatine phosphagen system a little bit more fun because
Yeah.
maybe you teach someone like kettlebell cleans, kettlebell snatches one at a time. Teach, like you can add some load to that, so it does feel a little bit more like there's a progression there. But a lot of times the not working hard in a training session can be a difficult sell.
Yeah.
So I think that has a lot more to do with education, to teach people like how to
Definitely.
do that on their own, whether maybe they're watching TV, watching Netflix, but the monitoring is key there.
Yeah.
But yeah, I mean, oftentimes it's that middle glycolytic phase that if people are training themselves, they're usually doing everything in that boat, and that's your stress producing system, right?
Yeah.
So that's why stress tends to be high, and it can be made higher sometimes by exercise, where you can really use exercise to bring stress down, or to just keep it, optimal for stress building, but also promote recovery if you're able to manipulate these systems.
Definitely. Definitely. And I think just last point on the aerobic thing too, like I always try to use heart rate monitors with people if they have them, but if not, then my go-to is always just using the talk test, which is
Yeah.
I think shown to be pretty reliable, but making sure that the idea should be with aerobic work overall, if we're kind of working on that really pure aerobic long duration stimulus, is hard enough that you can't necessarily sing through it. Not that anyone wants to sing in the gym, um, but easy enough that you're able to talk through it. So for people that don't have a heart rate monitor, I think that's just a good, easy first step.
Yeah, last point I'll make, going back to what you said about getting people out of their heads, or just the psychological components of movement, is sometimes it's when you really educate people on energy systems and the intent of their movement, it gives them permission to not have to work as hard, right? So
Mm.
I find that a lot of clients, they feel guilty about a variety of different things when it comes around exercise. Like they're not doing enough, they're not working hard enough. And really to show them like, no, you're actually, every time you do work out, you might be working too hard. Give them permission to not work as hard scientifically in a way, or,
Yeah.
back it up with, your knowledge and what you've learned. And then so if they monitor it, then it's one thing, but just even giving them permission to say like, no, the intent, you're working too hard. So the intent is not to work as hard, but we want to be maybe more consistent to be able to go longer. But I think in order for people to get more consistent, a lot of times they have to not make it feel as awful, right? And you
Yeah.
have to give them permission to make it easier on themselves. And that's a huge hurdle to get over a lot of times. But once you do, it can be very powerful.
Yeah. Couldn't have said it any better.
I think this was good use of our time this morning. I
Yep.
think both of us are fired up to go watch the Eagles play.
Yep.
So until next time.
All right.
Later.